World Liver Day is a campaign that started in 2019 in India and was relaunched in 2023 by EASL and the other regional societies around the world. It is predominantly a digital campaign. We run a website and a large-scale social media campaign, and on that website, members of the public can find information about nutrition, alcohol, and exercise, and other information about liver health. And the website includes things like interviews with a nutritionist, so answering questions about diet and lifestyle. You can find a recipe book that includes recipes from around the world, as well as myths, like a myth-busting section, and other interactive elements that allow people to really engage and learn about their liver health in a way that is culturally appropriate, accessible, and informative.
So firstly, this is a great opportunity for us as staff of EASL to actually interact directly with the population and hopefully impact their health and their lives of them as individuals and as their families. So for us, it's really an opportunity to interact directly, which is not something we can always do. On another level, it's a way that we can interact with our local professional members. So doctors, for example, at the HUG, who amazingly are going to be volunteering their time and expertise to partner with us. And this will become something that we do not only every year, but hopefully throughout the year, maybe citywide in the future. And perhaps with the longest term impact that this can have is that we will draw the attention of local policymakers. And they will understand not only the burden of the disease and how it can be detected and potentially prevented, but perhaps more importantly, draw their attention to people like EASL and like the doctors at HUG, who are the partners for them to reduce the burden on the local population.
So in Geneva, we have a particular situation where we have one large public hospital which covers the whole canton. And it's true that most of our time is spent within the institution itself, within the hospital. And I think today it's a great opportunity to do an outreach to the general population, to patients which maybe we don't have access to every day, who are dealing with their daily business. And so it's a great opportunity for us to go outside of our institution within the general life of Geneva and to be able to have access to patients whom we don't generally see. So I think in Geneva we have a very multicultural population. We have patients from all the different walks of life. We have patients from very diverse backgrounds, socio-professional, and also from who come from different regions. And I think we're also in the center of Europe. Many international organizations are based in Geneva, so I think we have a very unique place in Europe and in a very unique place where there is a very high added value for screening patients for liver disease and trying better understanding, and possibly also producing models which can be probably applied in other situations, other places in Europe, for example.
Well, we always say that EASL is the home of hepatology. And so equally, that means that Geneva is the home of EASL. EASL is very lucky, proud, and committed to being headquartered in Geneva. It's a great place to find wonderful team members. Where else can you find such a great group of professionals to serve our volunteer board? But equally, we can interact and network with other medical associations and with civil society organizations, and increasingly for us now with the WHO. So it's really the place where you find the people that work for you, the people that you work with, and increasingly the people you're trying to influence.